Hello, I'm Beth Wagner, physical therapist. In this video, I'm going to show you some excellent exercises to begin recovery following a patellar fracture. Every injury and every individual is unique. Overall healing time varies greatly based on a number of factors, including the severity of the injury, your overall condition, and overall bone health. I'll start by reviewing general stages of healing. But please understand that you might need a little bit more healing before it would be appropriate to start these exercises. Please be sure to check with your doctor before beginning these or any other exercises. Typically, during the first 6 weeks following a fracture, rest is indicated. Surgery might also be required, and oftentimes a brace is used, depending on the severity of the fracture. Sometimes doctors will recommend beginning very gentle active range of motion approximately 2 weeks after the injury or after surgery. Typically, gentle active range of motion is built up gradually over the next 6 to 12 weeks. After 12 weeks following the injury, then it's typically appropriate to begin strengthening. Now let's move on to treatment. I recommend starting with soft tissue massage of the areas surrounding the patella. I'll include a few anatomy slides in the video, and then I'll also demonstrate the massage techniques on my knee. The infrapatellar tendon lives just underneath the edge of the patella, and it connects the patella or the kneecap to the front of the tibia. And if you run your finger along from side to side along this area, just underneath the kneecap, you'll probably feel that dense band of tissue. Oftentimes after injury, after surgery, after using a brace for a few weeks, this tendon can be tight and a bit sensitive. So be gentle when you're performing this massage. I suggest moving back and forth across the tendon with 1 or 2 fingers. And you could use a massage cream, a massage oil, or something with some nutrition like a vitamin E oil or a bio oil. I suggest starting with about a minute of massage. Gentle back and forth. Mild tenderness is normal, but you shouldn't feel any sharp stabbing or severe pain. If you do feel pain, back off. Lighten up your touch. And if it's still too painful to touch, even lightly, then stop. It's probably too early to begin the massage. Try again in a week or so and see how it feels. Okay, moving from the infrapatellar tendon to the suprapatellar tendon. The suprapatellar tendon is just above the patella, and it connects the patella, the kneecap, to the quadriceps muscle. Now feel this area just above the kneecap and go back and forth. The tendon here is broader and not quite as thick, so you might not feel a band of tissue the way that you can underneath the patella. Just move back and forth across this area, again with 1 or 2 fingers. You can use a cream or an oil, or just gently move along your skin. And start with about 1 minute of massage. Start with light touch, very gentle, slow movement. As you get used to it, if you feel like you can go a little bit deeper, that's just fine. After about a minute, then move on to the quadriceps muscle, especially this lower distal part of the muscle, where it connects into the suprapatellar tendon. Now, the quadriceps muscle is fairly wide through the thigh. And you can use your whole hand, all 4 fingers and your thumb, and work the muscle in a circle. And you can also use thumbs of both fingers and move in circles. You want to start with gentle pressure. These tissues can be quite sore, especially after surgery. And they can be stiff and tight following a period of immobilization in a brace or a cast. If you notice any muscle knots, you can use your thumbs to settle into that spot and give it a little extra TLC. As you massage day by day, you'll likely begin to feel these tight tissues loosening up. The tenderness and the soreness will begin to dissipate. After about a minute of massaging the quadriceps, then rest. Now we'll move on to the exercises. The first exercise is a quad set. In this exercise, we'll begin to activate or engage the quadricep muscle. Start by lying on your back or sitting up with your legs straight and your back supported ideally. Tighten your quadricep muscle. Straighten your leg and try to pull your kneecap, your patella, up toward your thigh. And hold this contraction for a count of 3. And then slowly lower. And again, tighten the quadricep muscle. Try to straighten your knee. And now lift your toes up toward the ceiling. And hold for a count of 3. And then relax your foot and relax your knee. Again, tighten your quadricep muscle and bend your ankle, toes toward the ceiling. Hold for a count of 3 and then relax. Perform 10 repetitions. Tighten the quadricep muscle, bend your ankle, toes towards the ceiling. Hold for a count of 3. You should notice your kneecap moving up toward your thigh. And then slowly release. Tighten the quad muscle, bend your ankle, and straighten your knee. You should notice your knee becoming straighter. And release. Tighten the quad, bend your ankle. And hold for 3 and release. Be sure you're not holding your breath. Tighten the quad, bend your ankle, toes towards the ceiling, and continue breathing. After a count of 3, then slowly release the quad contraction and your foot. Tighten the quad, bend the ankle up, try to straighten your knee. And release. And continue. Tightening the quad, bending the ankle. Pause and release. Often it helps to look at your knee and to touch and tap your quadricep muscle to activate the muscle and to get it to wake back up after injury. So each time, try tapping the quad, looking at it. See if you can get this part of the quadricep to pop up, to flex. And release. In the next exercise, we'll build on the quad set with adding hip abduction, or a side leg movement. First, start by tapping the quadricep, do the quad set, and bend the ankle, and slide the leg out to the side. And then bring it back in. Only slide the leg out as far as you feel comfortable going. Tighten the quad, bend the ankle, and slide the leg out. And come back in. And then relax. Tighten the quad, bend the ankle, slide the leg out. Come back in. Tighten the quad, slide out, and return to the starting position. And relax. Tighten, slide out, and come back in. Be sure that you're continuing to breathe. You might try matching your breath with the movement. Inhale to prepare at rest, and then exhale. Quad set, ankle lift, and slide the leg out. Inhale, come back to the center. Relax. Exhale, quad set. Bend the ankle, slide the leg out to the side. Inhale, come back to the center. Relax. Exhale, quad set, slide. Inhale, back to center. Quad set, slide on the exhale. Inhale, back to the center. Rest. Quad set, slide. Inhale. Shoot for 10 repetitions. Start with what you can do comfortably and gradually add more repetitions, session by session. The next exercise is a heel slide to about 70 degrees. 70 degrees is the typical starting point for this exercise. Be sure to check with your doctor to make sure that's appropriate for you, for your injury, your stage of healing. 70 degrees refers to the angle of flexion at the knee. We don't need to measure this precisely. You can go by the feel. So a fully straight leg is 0 degrees, and a right angle at the knee is 90 degrees. So we want to back off of that about 20 degrees or so. So this is as high up into the heel slide as we want to go. Okay, so we're going to start with the leg straight. Think of this exercise as greasing the hinges or lubricating your knee joint. So don't push it. Just move up as far as you can and then lower. And with repetition, session by session, you will gain more range of motion. Okay, starting with the leg straight. Slide the heel just as far as you feel comfortable going, and then lower it. And slide it up again, and lower. You can also use a hand underneath the thigh to help slide. That's just fine. Just be sure that you're not pushing too far into the motion. We want to be sure initially that we're not bending the knee more than 70 degrees, which is about here. Keep in mind that a right angle of the knee is 90 degrees, so we want to stop well before we achieve a right angle at the knee. Once you're able to flex to about 70 degrees, just continue performing repetitions up to 70. After about 6 weeks following the injury or following surgery, typically it's appropriate to begin adding about 10 degrees of flexion every week. Check with your doctor before you begin increasing the range of motion. So slowly, week by week, gradually begin to bend, slide your heel, and bend your knee higher. You can still use a hand or both arms underneath your leg as you need to for support. Make sure you're not holding your breath. Continue to breathe naturally. There's no specific breathing pattern that I would recommend with this exercise. Just be sure you're not holding your breath. With this first group of exercises, I suggest starting with 1 time a day. Once you're able to complete 10 repetitions, then continue to increase the repetitions to 15, 20, 25. Then try adding a second set in a day. For the first 6 to 8 weeks or so, it's great to gradually build up until you're doing 3 to 4 sets of these exercises every day. For the rest of the exercises, I suggest sticking with 1 set for the day. For best results, perform these exercises every day of the week, but it's just fine to take a day off now and then to rest. Now we'll move on to standing exercises. The next exercise is standing hip abduction, or a side leg raise. Start by standing in front of a countertop for balance support. The first step will be to perform a quad set on both legs. So tighten the quadriceps, straighten the knees, and try to lift your kneecaps slightly up towards your thighs. Okay, shift your weight onto the right leg and lift the left leg up to the side just as far as you feel comfortable, and then lower it back down. Now shift your weight over to the left leg. Keep the quads engaged and lift the right leg up to the side just as far as you feel comfortable and back down. Keep this movement small. This isn't meant to be a giant high leg lift. These exercises should be performed with slow, smooth, controlled motion. Okay, continue. Shift the weight onto your right leg. Maintain the quad set. Lift the left leg up. Pause and lower. Shift your weight to the other side. Lift your leg up. Pause and lower. Shoot for 10 repetitions on each side, 20 repetitions total. Start with what you can do comfortably. Build up as you can, session by session. Continue using your countertop for some balance support. This is not meant to be a balance exercise. This is meant to be a strengthening exercise. Reset your quads whenever you start to feel the quadriceps fatigue and you lose the quad set. Continue activating your abdominals and tightening your glutes. Try to maintain smooth, symmetrical motion. After 20 repetitions, rest. Shake out your legs if you need to. Get a drink of water, and then come back. And now we'll move on to standing hip extension, which is a back leg lift. Starting with your hands on the countertop for support, abs and glutes engaged. Now shift your weight to the right leg, lift the left leg back, up just a few inches off the ground, and then return to the starting position. Shift your weight to the left leg, lift the right leg up. Pause and lower. Keep your quadriceps active. You don't need to keep your knees fully extended with this exercise. A micro bend in the knee is just fine, but continue to try to keep your quads strong and engaged. Okay, let's continue. Shift the weight, lift the leg, and lower. Shift your weight, lift the leg, and lower. Continue with smooth motion. Try to keep your pace smooth and symmetrical. And lift the leg just as far as you feel comfortable. Start with small amount of motion, small lift, especially the first few times you do these exercises. And keep your ankle bent, toes up toward the front of your shin. So you're not pointing your toes like a ballerina, but you're keeping your ankles bent up. Now I'll show you this from the side. Shift your weight, smooth controlled motion on the leg lift and lower. Keep the abs engaged. Keep your glutes firing when you lift the leg and when you're standing on your leg. You should feel some stretch discomfort, maybe some muscle fatigue, even muscle soreness, but you shouldn't feel any sharp shooting or stabbing pain. Stop right away if you do. Reset your posture. Try a smaller leg lift. If you still feel sharp pain, then stop the exercise. That means it's not time yet to begin these movements. Try again in another week or two and see if you're able to complete the exercise without pain. The last exercise is heel-toe raises. Begin standing in front of your countertop for support. Tall posture, abs and glutes engaged. Stand with equal weight bearing, meaning you have 50% of your weight on your left leg and 50% of your weight on your right leg. You might try just shifting your weight a little bit side to side. Get a feel for how much weight you're bearing through both legs. And then come back to the center, so your weight is even between your left and your right leg. Okay, with your hands on the countertop again, Let's rock forward onto the toes and lift your heels up. And now slowly lower your heels, rock back, and lift your toes. And then slowly lower your toes, rock forward again, lift your heels. Rock back and lift your toes. This exercise, like the last two, is a strengthening exercise, not a balance exercise. So maintain support with your hands on the countertop. Rock forward and then rock back, lift your toes. Rock forward, lift your heels. Have your feet about hips distance apart so you have a nice wide base of support. Be sure to continue breathing. Don't hold your breath. Try to keep the quads engaged when you're rocking forward and back. Continue for 20 repetitions. Start with what you can do comfortably and build up session by session. And this is a strengthening exercise, not a balance exercise. So be sure to use your countertop for support. After 20 repetitions, rest. All right, you've completed this exercise program to begin recovering from a patellar fracture. Typically, after 12 weeks following the injury or surgery, it's appropriate to begin strengthening exercises. Check out the links in the description below for some of my other videos with hip and knee strengthening and stretching exercises. I hope you find these exercises to be helpful for you. If you like this video, please give it a thumbs up and subscribe to my channel. If you have any questions or comments, leave them down below. Here's to your healing, health, and happiness. Have a wonderful day.